COVID-19 here in the city of Baltimore. We had a 48% decrease from 1 month ago. Our positivity rate is down 50% from 1 month ago. There are currently 285 people hospitalized because of COVID-19. 85% of our ICU beds and 82% of our acute care beds are currently being used. And we have lost, unfortunately, 771 people here in Baltimore from COVID-19. We continue to be very optimistic about our trends. Baltimore City continues to head in the right direction. I want to thank all of our residents, visitors, everyone who's done the right thing by wearing your mask, making sure that you're properly physically distancing, following and adhering to all guidelines. All of these actions benefit our community as a whole. Today, after consulting with the Health Commissioner and our partners, I have made the decision to adjust Baltimore's COVID-19 mandates effective Monday morning at 6 a.m. Gatherings. We have been adhering to a strict 10-person indoor gathering and 25-person outdoor gathering policy. Those limits will be removed. Now all gatherings must comply with any relevant occupancy based upon the space in which they are located. Food service establishments, bars, and breweries, the 1 hour max time limit is removed. Restaurants must continue to maintain a sign-in, sign-out sheet for patrons and staff. As a reminder, indoor dining is still allowed at 25% and outdoor is still allowed at 50% maximum occupancy. Please remember that all outdoor dining spaces must be open on all sides with no enclosures permitted. This means outdoor tent with no sides is permitted. It's not permitted. Gym classes are permitted at 25% occupancy or 10 people, whichever number is higher. Live performances are permitted as long as performers wear masks and adhere to physical distancing. Note, adult entertainment remains prohibited at this time. Organized sports. Organized amateur sporting events including high school, youth, and recreational games, clinics, skill sessions, scrimmages, and practices are permitted in accordance with dates and guidance from the Baltimore City Department of Rec and Parks. Tournaments and organized amateur sport events with teams from outside the state of Maryland are prohibited at this time. Face coverings shall be worn by all participants engaged in the field of play and everyone present. Indoor amateur sporting events are limited to 25% occupancy, provided that there are no more than 50 people per activity area. And now I will turn it over to Dr. Terrazza for further comment about the decisions and where we are today. Dr. Terrazza?
Good morning, and thank you, Mayor Scott, for your leadership during this pandemic. I'd like to briefly share the data on the key metrics here in Baltimore City. As of yesterday, as Mayor Scott mentioned, we've lost 771 lives to COVID-19. We have had a total of 39,532 cases in Baltimore City since the pandemic began, and our latest 7-day average new case count is 125 cases per day. Our latest 7-day average positivity is 3.1%. Our hospitalization rates, as Mayor Scott has mentioned, have decreased slightly, but do remain high, with ICU at 85% capacity and our acute care units at 82% capacity. We've seen a slight decrease in fatalities now, averaging slightly more than 2 deaths per day. Turning towards vaccinations, as of today, the Baltimore City Health Department has provided 8,092 first doses and 3,075 second doses for a total of 11,167 doses. In total, 55,859 Baltimore City residents have received their first dose, and 25,501 have received their second dose of the COVID-19 vaccinations. This puts about 9.4% of the city population now having had at least one dose of the vaccine. Most city residents have heeded the advice of public professionals, have taken social distancing precautions seriously, and have been wearing their face coverings. Today's announcement, easing certain restrictions, comes at a time where we're cautiously optimistic based on the downward trend in several of our metrics from the spikes that we saw during and immediately after the holidays. With decreased positivity and with hospitalizations and fatalities beginning to decrease based on the data we have available, these modest allowances are sensible and based on an understanding that Baltimore residents will continue to heed public health guidance. There have been several peaks and lulls in our case counts over the last 11 months since the very first COVID-19 case was reported here in Baltimore City. Lulls in our case counts have never been and are not now an invitation to engage in reckless behavior. Vaccines are still in scarce supply, and while we're encouraged by the recent federal government announcements to ship more vaccines to Maryland, a large portion of our population still needs to be vaccinated. We also remain concerned about the appearance of new variants of COVID-19 in Maryland, which serves as a reminder that we are still in an active pandemic, and now more than ever, we should remain vigilant, keeping the safety of ourselves and our loved ones in mind. Contact tracing remains as important as ever to quickly identify disease transmission, and we still need residents to pick up the phone when MD COVID calls. Additionally, testing remains a vital component of the overall pandemic response, and we encourage residents to get tested if they've experienced symptoms suggestive of COVID or if they've been in close contact with someone experiencing symptoms of COVID or who has tested positive for COVID. Our mobile testing clinic is posted weekly on our social media accounts and on our website, coronavirus.baltimorecity.gov. Washing your hands, wearing a well-fitted, multi-layered mask securely covering your nose and your mouth, keeping at least 6 feet of distance from others not in your household helps to limit the spread of COVID-19. With your help and continued following of this guidance, we will continue to see our trends move in the right direction while vaccination rates increase. Thank you.
Thank you, Dr. DeRosa. As she said, we need our residents and visitors and everyone here that comes to Baltimore City to again continue to be proactive. This is still a pandemic. Dr. DeRosa and I will continue to analyze the data on a regular basis to monitor where we stand, but this is not an invitation to act recklessly. Make sure that we are still adhering to all of the advice that you hear from Dr. DeRosa, myself, and everyone else about how to protect yourself and those that you love and care about. Also today, we announced $8 million in state grant funds to provide economic assistance to Baltimore hotels impacted by the pandemic. Visit Baltimore will be managing and distributing these funds. And while the pandemic is far from over and we have a long recovery road ahead, these funds will help our hotels continue to weather these unprecedented times and play a key role in our economic rebound from COVID-19. To qualify, hotels must have been open and operational prior to the COVID-19 pandemic and must have contributed sales tax revenue. The application will be open tomorrow, Thursday, February 18th at baltimore.org/hotel-grants. That's baltimore.org/hotel-grants. Those dollars will be moved out by March 31st, 2021. I also wanted to ensure that everyone is aware that a second round of PPP, Paycheck Protection Program loans, are available to our small businesses, sole proprietors, and independent contractors. These loans are intended to help businesses keep their workers employed during COVID-19 and are available through a collaboration between the Baltimore Development Corporation, community partners, the Neighborhood Impact Investment Fund, and the Opportunity Fund. Applications will be accepted on a first-come, first-served basis until March 31st, and new borrowers and some existing PPP borrowers can apply. You can find the link to the application and additional information at BaltimoreTogether/COVID resources. That's BaltimoreTogether/COVID resources. And before we close, I'd like to turn it over to our police commissioner for comment.
Good morning, and thank you, Mayor Scott. This morning, I am happy to report that with the public's help, we have arrested 2 more members of the top 5 offender list. 41-year-old Lenny Epps was arrested and charged for a triple shooting and death of 16-year-old Alyssa Taylor that occurred on January 23rd, and 20-year-old Jason Brown was arrested and charged for a homicide following the death of 33-year-old Marvin Desor that occurred on January 1st. So far this month, our officers have been working hard to apprehend violent offenders and take them off the streets of Baltimore. This included making arrests in 6 homicide cases and 7 non-fatal shooting arrest cases. A total of 15 suspects have been arrested for violent crimes, and 6 of them are repeat violent offenders. So I want to thank the hard work and efforts of our officers as well as our law enforcement partners at the local, state, and federal level. Together, we will continue to be laser focused on those responsible for the violence in our city. I turn it back over to our mayor.
Thank you, Mr. Commissioner. And let me just add on to what the Commissioner is saying and thanking the hardworking women and men of BPD for their work, but also to send a message that they are sending with that hard work. If you are going to be someone who is cowardly killing children and women and men in the city of Baltimore or shoot people, we will find you and we will work hard to remove you from the streets. And I want to say that I am thankful to the work, the continuing hard work of the people in the police department and all our agencies and our community partners and Safe Streets and everyone who's working hard every day to reduce violence in Baltimore. And with that, we'll take a few questions. Yeah, Master can't hear you, sir. It's all right.
Mayor, how encouraging is this that you're able to make these changes to show folks here in Baltimore that things are where they can be, where you can do more things?
Well, we're very encouraged. Like you heard us say, that we're encouraged about these numbers, but we want to also remind people that we are still going to be cautious. We're still in a pandemic. It is encouraging. We know that we have the lowest positivity rate in the state. We want to keep it that way, and we're going to do that together by making sure that even with us relaxing some restrictions, that people are being cautious, of being safe, and not just being reckless with their activity.
Good morning, Mr. Mayor.
Good
This is
morning.
a off-topic question, but are you aware of any rules that require city officials to report out-of-town travel regardless of who is paying?
So I think you guys already know this, but the city solicitor is reviewing that and will be issuing an opinion that we'll be sure to share with you guys.
Yesterday, it was reported that the Baltimore City Convention Center mass vaccination site is getting significantly fewer doses of the vaccine than the Six Flags site in Prince George's County. What's your response to that, and do you think that's acceptable?
Well, you know I don't. I think if you've heard me talk about it consistently, how we need to have a more equitable distribution of vaccine in the state of Maryland. This is something that we'll be going back and talking to the governor and his folks about again, about how. This is why we made the action that we made with Johnson & Johnson, because we feel like we see, not just here, but you've heard it from folks across the state, Republican and Democrat, about how the way the vaccine is being distributed in the state isn't working for us. Thank you. Alexa, I think that's you.
Listen, this is before my shift normally starts. I actually have a question for the commissioner
Yes.
with his public safety update. Okay, so today marks 1 month since Dante Barksdale's homicide. What's the latest on that investigation? Where do things stand?
Well, it's still an ongoing investigation. We have had information to come in that has been helpful. We always need more. It's still an ongoing investigation. Detectives are still working around the clock processing evidence and making sure we have what we need. But we always need more. And at this moment, I still encourage people who know what happened, because we know people were out there, please get in touch with us or get in touch with our Crime Stoppers tip line, which you can do anonymously.
The other case that I wanted to check on was the search for Marquise Poteet in the shooting death of MTA Mobility driver Frankie Duckett. How important is it to get specifically these suspects off city streets, in terms of these were both people who were out doing work for the city?
It's absolutely important. When we have people doing work, doing what they're supposed to do, being where they're supposed to be, helping the residents of Baltimore, it's very important that we find and apprehend these violent offenders who commit these heinous acts. Number one, to bring closure to families, but number two, so we can hold them accountable. As you heard me say just a few minutes ago, a number of the arrests that our members made this month have been repeat violent offenders. And some people commit more than one violent act. It's very important that we send a message to the individual committing the act that it's not going to be tolerated, and to those who are in that lifestyle who think they might want to do that, that if you do it, as the mayor said, we will find you. And the message is, if violent crime is the life you choose, prison will certainly be the price you'll pay.
Thank you, everybody.